to get started now. I will just remind for the people who just joined us, this meeting is offered in 2 languages. We have it in English and in French. If you don't speak French, we recommend you go on the icon at the bottom, the globe, and you select the English channel to ensure that you will get translation for the French-speaking parts. We are extremely fortunate to have Ariel and Amaya, who are pro bono offering us translation today. So thank you so much for them. They claim it's a win-win because they get to practice. It's definitely a win for MSF. So thank you so much, Amaya and Ariel, for the translation today. I'm going to switch to French just to make sure everybody's aware of the translation, and then we'll kickstart the program. Pour ceux qui viennent de nous rejoindre, cet événement.
For those who have just joined this event, it will happen in French and English. You have a small globe icon to choose the channel, and you'll be able to choose French, for example, for the English parts that you might not understand, or you can stay on the main audio. We are very lucky to be able to collaborate with Ariel and Amaya today for interpretations. They're doing it pro bono and tell us that it's a win-win situation because they are able to practice, but we are certain that as to the MSF, we are very, very happy to work with them. So thank you, Ariel and Amaya. We will now begin the event.
So welcome everyone. Today we're going to have an event on the inclusion of people with disability, and we want to see where we stand in MSF on this topic. And the reason we have it today is because tomorrow is actually the International Day of People with Disability, and we just wanted to take that opportunity to update you on where we stand in MSF. And I just want to walk you back a few years. In 2016, a motion was presented at various associations, including the OCB gathering, as well as the IGA, a motion asking MSF to be more proactive and ensure that inclusion of people with disabilities was present in our operations, in our project, in our offices. This motion gathered massive supports in all the associations where it was presented, and it was passed at all levels, including OCB, including the IGA. Since then, this motion has become a project, and we'll hear about Patrice, who is with us today, and who's the coordinator of the MSF Hub on inclusion of people with disability. And Patrice is going to tell us a bit about how we're doing in MSF. Are we good at reaching people with disabilities as patients? We're going also today to cover the question on, are we good at recruiting and keeping people with disabilities in our workforce? And we also want to hear from you on how can we do better? How can we do that? So this is the scope of today's event. And alongside Patrice, we are going to welcome also Louise Limela, who is currently the association coordinator in DRC. And Louise has worked a lot in getting in contact with Association of People with Disabilities in DRC and work hand in hand in ensuring that they do relay ways for us to work closer with the group of people of inclusion, the group of people living with disabilities. So they will tell us more. At this point, I just have a few household items to mention. We ask everyone to please mute yourself when you're not talking. If you can keep your video on, this is wonderful. We understand it's a lunch and learn. So if you're eating and don't want us to see you mention, that's fine. But if you have the possibility to have your camera on, this is always nice to see who's around, and it makes us feel that we're all together in here. So this is great. We like you to use the chat mostly for questions. If you can refrain from using it as a parallel debate, that would be great. At the end of Patrice and Louise's presentation, we'll have space for Q&A, and we'll use the chat for that. But we even prefer that you raise your hand and ask your questions directly by switching on your camera and your microphone. So that's the way we'll want the Q&A to operate at the end of this meeting. We also have the reaction buttons that you are surely familiar with now in Zoom. So please let us know if we're speaking too fast, if we're going too slow, or anything that you can clap, you can be happy in the reaction button. And I will try, I realize I haven't been good at this, but I will remind people to speak not too fast for poor translators that must already struggle with me zooming through everything here. So yeah, this is mostly it. we're going to kickstart this session today by a short video that explains what the inclusion of people with disability project is about. And in order to do that, Sophie is posting now in the chat a link to the video that we suggest you watch as an introduction to this topic. So it's a 5 minutes video and it's offered in 4 languages. You see it appearing right now in the chat. For bandwidth reasons, it's always better that you actually click on that link or copy it in your browser to watch it rather than us putting it on Zoom, and it enables you also to watch it in your favorite language. So I'll give you 5 minutes to watch this video, and then we'll resume back here on Zoom in 5 minutes. See you then. Okay, so I think this is time, and the video must have ended pretty much for everyone at this point. So without further ado, I'm just going to give the word to Patrice, who's going to walk us to where we stand today when it comes to inclusion of people with disabilities.
Okay, thanks a lot, Sylvie, and welcome to everyone. And very nice to see so many people on board, and so many people that I know also are supportive to inclusion of persons with disabilities. I know quite a few people, and very nice to see all of you, and very nice to see so many people. So I will start with sharing my screen to show a short presentation that you will receive after. So don't worry too much about taking the link. You will have a lot of links, so you will receive the presentation after, and you will be able definitely to get all the links that I will present today, because one point is also that I present you all the resources available. I will try to do my best to not speak too fast, like Sylvie did. Sylvie has been good to slow down, so I will try also to slow down by respect for our translators. If all worked well, you should now see the presentation. Yes. So as mentioned by Sylvie, our starting points are really the questions that are we good in MSF at reaching a person with disabilities as patients? Are we good at recruiting persons with disabilities in our workforce and also at keeping them? And in any case, if we are good or not, can we do better? I think the responses, we can already give definitely some elements of response. One, and you saw it through the video, is that we have really, as a humanitarian medical organization, all the reasons to be careful to not exclude people with disabilities who are very often in countries where we work among the most vulnerable groups. So as a humanitarian organization, we have really a duty to keep in mind to not exclude this particularly vulnerable group. Also, as mentioned by Sylvie, we have since 2016 a motion on inclusion of persons with disabilities. I will quickly show a summary of the text. We have also, for everybody in the movement who wants to work on inclusion of persons with disabilities, we have now really a rich toolbox and set of resources. And we have also a lot of supporters. We have really a good network. We have some good practices and initiatives already that we can share. And we will be able to get even more initiatives to be able to share them. However, we can definitely say that we can do still much more in MSF and better. We are not systematic enough. We are not really enough inclusive of persons with disabilities in all our projects and in all our headquarters. And we don't have really today an overview of where we are. And that's a very important point. So we will try really in the coming years to collect more data to see where we are in the movement. So this motion on inclusion of persons with disabilities, it was very straightforward. In 2016, we said that MSF should develop awareness on the risk of exclusion of persons with disabilities, should develop a dialogue with our DPOs or OPDs, meaning organization of persons with disabilities, organization representative of persons with disabilities, what we can do in our projects like in our headquarters. And we should definitely work also on the accessibility of our structures and the accessibility of our communication. And you saw that in the video, but we took back all these points and developed them, and we continue to develop these points for all our projects and missions and headquarters to benefit from these points. So we have a lot of resources and tools in MSF today. We have a video so that you saw now in 4 different languages with each video a guideline associated. We have a training online, e-learning today in English, and that we are at the moment translating in French. So it will be available in French at the beginning of next year. That is good news. We have construction guidelines thanks to the operational center of Barcelona, Athens. We have operational framework also. I will show it also. That is called the Basics, made in collaboration with WACA. We have also a communication toolbox, a small briefing. Everything is okay. I hear a bit some sound. We have a briefing document on how to make your office inclusive of persons with disabilities, a briefing document on how to work on the accessibility of your web content. And we are going to continue to develop documents based on needs. So here you have the link to the portal. So if there is one thing to remember, it is a link to our portal on inclusion, where you get all these tools, disabilityinclusion.msf.org, where you have all these tools and access also to our e-learning, access to the videos and so on. You have here all the links to the 4 different videos, and we will continue to work to improve these videos. At the moment that, in fact, we are talking, Marion, I saw she's online. She's the one who made these videos with the 2 flying creatures. And so big thanks to her. And at the moment, I know she is working hard with Louise to produce a new version of the video also in French. So thanks a lot to her for all the work that has already been done and the work that she's still doing today to improve these materials. Here is a link also to our e-learning. So it's a 90-minute course that has been done in collaboration with an organization of persons with disabilities based in Malawi. So an organization that has a lot of experience on how organizations like MSF should become more inclusive of persons with disabilities. For the one who like Tembo, so Tembo is in MSF, our platform for e-learning. So for the one who have Tembo, access to Tembo, they can also have access to this e-learning on Tembo. You just search for a disability in the search engine. Voilà, and thanks to Ogba, I mentioned also a few guidelines on accessibility and universal design and an accessibility checklist. So also, in fact, the guideline is available in 4 different languages: English, French, Arabic, and Spanish. Voilà, so thanks a lot to Ogba for the big work they did during the COVID period on these guidelines. And we have also, if you need, in a mission, we have also an expert, Cora, who is an expert in universal design, who is also able to help us on a pro bono basis if there is any need in your projects that you would like an external expert also to give advice. We have the basics that we developed very recently with WACA this year. So WACA is our West Africa, Central Africa Operational Center, and we developed with WACA so basics. So that means operational framework to say, okay, to be able to check if your project is inclusive of persons with disabilities. So very, I just put a bit of picture of an extract of this framework to give you an idea, but it's really a very good tool where you can just check if the different components that create accessibility in your project are implemented. So very practical guideline, and you have the link to this guideline here. Voilà, and we have, so in MSF, a lot of supporters, a lot of good practice, and a lot of initiative. I wanted to mention a few examples. Some are a bit historic. For instance, there was a project in 2017, so even before we started the hub on inclusion of persons with disabilities, some projects had already the concern to be more inclusive of persons with disabilities. And in Eswatini, formerly known as Swaziland, you know that we had a TB treatment project, and this old TB treatment had sometimes the side effect to provoke for patients to become deaf or hard of hearing. And so this project had really the idea to train patients and train the staff and train the family of patients to learn a sign language so they could continue, the patients could continue to have a life after the treatment, even in case they were becoming deaf. Fortunately, today, the treatment have really improved a lot, but that was a reality of the past. What is interesting in that project is that as a consequence, people who were also deaf in the community were coming back more willingly to this clinic because they knew that the staff was able to practice the local sign language. So I say local sign language because, as you may know, it's a few hundreds of sign language around the planet. So you have always to learn the local sign language. Voilà. Another project that I like to mention is the one of OCB in Mbare, a project on sexual and reproductive health, that already in 2018, the team had really this awareness that looking at their patients, they could see that they didn't have a person with disabilities, adolescent with disabilities among their patients. So they said, and that is really the thing to learn, they said, okay, we don't see person with disabilities among our patients. There is something wrong in our project, so we have to improve our project. And what they did was really a good set of actions. One, really map the actors working with persons with disabilities and network with them to bridge the gap, train the team, and that's where we started with, we had our first training on inclusion of persons with disabilities with this team. So it is FEDOMA, an organization of persons with disabilities based in Malawi, who came to Zimbabwe to train the team during 2 days. And it is with FEDOMA that we developed also this version online of the same training so that it could benefit to everyone. So we trained the team, and also the team worked on the physical accessibility of their structure. Another example, also very, very informative, and to show that we can be also innovative in our projects, is the family center reconstruction in a refugee camp in Beirut, Lebanon. So the team was working on really rebuilding this family center, and they wanted it really to be very accessible, and they didn't know what to do because it was a building on several floors with no lift. So I said, how can we make a building on several floors with no lift still accessible? And between the discussion with the medical team and the logistic team, they found a solution that was very innovative. They said, okay, let's make the ground floor very accessible for persons with disabilities, have a multifunctional room in this ground floor where all the medical team from the different levels can come and provide health services to persons with disabilities. Then we will have only to come to the ground floor to get medical support. So very interesting and innovative solution. Another example also, and there I want to thank really the health promotion platform of the OCB, and JC has been really an extraordinary supporter to inclusion of persons with disabilities in health promotion. So during the COVID, we managed to pass the message in the intersectional guideline for the COVID response for all health promotioners to really use organization of persons with disabilities to disseminate our messages on inclusion of persons with disabilities. So to not forget to use these channels as really key channels to pass messages about the barriers to use to avoid the contamination by the COVID. So also use 2 ways of communication was also one of the other messages. So always to think 2 ways of communicating, audio and visual, so that we could reach our population. And I put here for the people who have access to ShareLog, the page on ShareLog for the health promotion. Voilà. So I will not talk, of course, about the associative project in DRC because Louise is going to talk about it, and as is the lead, as the one who has been launching this associative project in DRC, which are really excellent example of collaboration with organization of persons with disabilities. So that I will leave it definitely to Louise. And I just wanted to mention to finish that you may have seen also yesterday a very good communication package that was released by MSF, the Operational Center of Amsterdam, that had really a very, very good package for the International Day of Persons with Disabilities, raising the issue of older persons and persons with disabilities, who are often the most vulnerable in situations of humanitarian emergencies, taking really Ukraine as an excellent example of this type of situation that we find in all this type of context. So very, very interesting package. And so you will get this communication in these days. Here I talked a lot about the initiative at the field level, but there is at the project level, but there is also a lot of initiative that has been taken in headquarters and creation of working groups in MSF UK. Paris also this year is also very active in creating a group of persons with disabilities who want to provoke an improvement of the situation in the headquarters in terms of inclusion of persons with disabilities. A lot of officers have been working on their accessibility. If you visit OCBA office Barcelona 10 in Barcelona, you will see how accessible this office is. OCA has been very active on their also accessibility. India office also. MSF-Norway has been also very active on another aspect, that is the induction, so onboarding on new staff. So any new office member who starts in the Norwegian office has to follow the training online on inclusion of persons with disabilities. I know MSF International is very active on working on the accessibility of their portal. If you go on their portal, you will see this small accessibility icon, and they are working very hard on it. So thanks to Jean-Marc Sfer, and he will be definitely a source of inspiration for the movement. There has been a lot of raising awareness sessions in the movement, and a lot also sections are working more in collaboration with DEI efforts on inclusive recruitment. So how can you all contribute? And that's a bit my last slide to reassure the team. So really appoint focal points, so someone in your project, in your team, who keep in mind, in fact, this inclusion of persons with disabilities, and who can build a working group around them. Use this 5 minutes video to raise awareness, learn about inclusion of persons with disabilities with our e-learning, and spread this e-learning, and discuss together with your team action points, and share also your efforts with other projects, with other teams, and with us, so that we can share it also across the movement through our portal and newsletter. And do not hesitate to contact us. Voilà, a big thanks to you. And I finish with a picture where we have Louise Limela, in fact, in action with her team in DRC. So Louise, now I will stop my presentation here, and Louise, the floor is yours, and I will stop sharing. And I switch to French also. Donc Louise, je te passe la parole. Un grand merci de mon côté. Thanks to
Louise, thank you for listening, and the floor is yours. Good morning, everybody. Like Patrice has said, I don't know if you can hear me. Can you? Is the sound all right? Wonderful. So I am Louise Limela. I am working in a hospital. I don't know if many people are nurses just like me, but I have worked in the MSF for about 14 years now in different projects as a manager, as supervisor. And I have closely worked hand in hand with them for a while. Now, when it comes to inclusion, I think that when I began to become the associative coordinator, I was working with Patrice in 2018, and he gave me all these documents which he sent me to start the inclusion of this movement since 2016. I was not present when that happened, but I did receive the documents for it. And these documents summarized our entire mission. And as the associative coordinator in 2019, I believe it was in 2019, or at the end of 2019, I had visited people with disabilities, and we talked to them. And we saw, by talking to them, that the situation was absolutely horrible. And there was a problem with going to the toilet even, and the situation was very complicated. And thus we had to talk to the executive officers that were with us, and we had to ask them whether it was possible to try and give donations, or if they could intervene one way or another to help the situation. We received donations. We have sensibilized people in this regard, because truly the place where they lived was a true dump, and it was difficult to appear hospitable for those places and those people in the place where they lived, because it was a true risk factor. Now, in 2018, like I said, in 2020 as well, everybody was stuck at home, and it was difficult to reach these people even more than usually. Everybody was at home, the associative coordinator, myself included. So this was a huge problem, especially with the perception of COVID. How do you tell people what COVID is if they cannot hear? And so at MSF, we had this dilemma. Do we go and intervene and risk getting COVID, or do we stay at home? Thus, the executives who were already doing their best to heal people, to sensibilize the population to these problems, well, we associative coordinators had this dilemma again. Can we help the executive officers when it comes to this pandemic? It was very difficult, but we have pushed through, we have provided arguments, we have debated, and our chief agreed for us to help. We started by doing inquiries within these communities of people with disabilities. We did surveys, and we discovered that more than 85% of the population did not know about the problems of people with disabilities. And there was a problem of lodging as well. They had no accommodation. Again, this was obviously a problem because they were at a higher risk of being contaminated by COVID. So people with disabilities were visited, but people came from different countries. Now, whether they came from other countries, or it could sometimes be a question of propaganda as well. Were they truly trying to help? So these people with disabilities did not know which help to accept. And so this was a problem as well within the community. We have done analyses, and we found out that the population of people with disabilities were not sensibilized about the pandemic. They did not know what it was. So there was not a single organization, humanitarian organization in this domain. And I could say that they were truly isolated because people were exposed without knowing about it. This is where the initiative came from. We should do something. We should sensibilize the population. We have presented this project to the executives, and from there, the medical executive have helped us to realize this project. Now, the MSF was not alone. We needed help from our peer educators and from other associations, which were, I believe we were 18 at the time. And they were instructed by MSF on the COVID situation. And that way we could transmit the message from one person to another and sensibilize them, whatever their category was, whatever disabilities they had. For example, we could sensibilize a deaf person or people who could not see clearly, who were blind even. And thus the peer educators, as well as interpreters, sign language interpreters, we received help from them. We also developed Braille because that too sensibilized people and their peer educators as well. This has thus created tremendous communication between MSF and other associations, especially of people with disabilities. And we had a good image at the heart of those communities. We could also have a different good perception of the situation. And in 2019, we asked ourselves the question, so where are we now? Because we had already made significant progress, but we had made even more progress then. It was very important that MSF took this initiative and did those first steps, Now, after COVID, the same question was asked. We had a 3-month vacation from September to December, and the question was raised. Since COVID is over, what is going to happen? Is MSF going to leave us behind? That was the question that the people with disabilities kept asking. Because in the environment where they lived, they don't have a job, they don't have anything, they don't have a house, they are poor, they are malnourished, they sometimes have to survive on drugs or on with working conditions that are absolutely unacceptable, and the living conditions are horrible. And so they asked us to sensitize them about AIDS and HIV. This was, again, very important. It's a sensible question. And it was important that people with disabilities were aware of everything that happened with HIV. And it's important to say that in our community, in this community, it is difficult to sensitize children as well, because they are simply, they don't have education, they don't receive education, they're simply accompanied by people, whether they are people with disabilities as well or not. And these children are simply a means of support for them, and thus they do not receive education. Of course, this is a problem too. So this was a sort of door for us to help them as well. It was important to sensitize people not only from the medical point of view, but also from an educational point of view. In 2021, with us began another project which was made for that, to support the projects and the different missions and jobs to sensitize people in this regard. We have thus formed 17 more peer educators as regards HIV, AIDS, etc.
The association did not do this on their own. The chiefs of mission, the chiefs of project, the team members, the executive staff, logistical staff collaborated in this with the executive and helped us to implement this project and work in collaboration. The implementation of this project, in terms of peer educators and associations, we also worked on networking. Of all the associations, we chose 11 and have been in touch with the ministry in charge of persons with disabilities. If you look at the video, you will see that we went to visit the minister in charge to advocate on this matter so that people, disabled people, could have access to care. I will provide the example of a pregnant woman who goes to the hospital and does not have access to training. Accessibility is extremely important for these people. If this lady goes to the hospital, the nurse does not know sign language, the doctor does not either. And this is very complicated for these patients. For people who are hard of hearing, or those who have mental disabilities, a person who is disabled cannot move. So even at MSF, these people are trapped to have access to care. And by raising awareness, we've seen that people can raise awareness among themselves. And we can train them and guide them in this respect. But they are discriminated and isolated and do not have access to care or to work or to education. What is important here is that MSF as an organization, as a humanitarian organization who works in the medical realm, can help people with disabilities in order to access healthcare, education, and work, of course, because we were saying that people with disabilities were not here, but I am an example. I've seen this with my own disability. I am here, I work, and I give everything that I can, taking my disability into account. Beyond people's disabilities, we need to look at people's competencies in order to help others. If you have any questions, and this is, well, the experience that we've had in RDC and WACA in order to expand our projects. We've seen that the associative movement has really given strength to this movement, and this gives us hope. Thank you very much for everybody's support. Thank you very much, Louise. Thank you for sharing your experiences in DRC to ensure that MSF can reach people living with disabilities within communities. It is now time for all of you to ask questions. Patrice and Louise are here. Please do not hesitate, do not be shy, and feel free to ask your questions, ideally raising your hand using the Zoom function. And if this is not possible, please do make use of the chat. Raise your hand, please, using the reaction buttons just like this as I am demonstrating in order to notify us that you wish to intervene, and we will give you the floor. If you cannot do that, please do make use of the Zoom chat function to ask your question. We will share the question with everybody. So do we have a first question from participants? Okay, Kumar, thank you. Go ahead, please.
If you can, wonderful.
Kumar, I'm going to try to speak English and French. I hope not to interfere with the interpreter's work. Thank you very much, Patrice and Louise, and thank you for all the work that you're doing and for your concrete examples. My question is, since you're trying to expand access, what do you think are the main obstacles that people with disabilities, sort of in terms of attitudes, what can we do to help these people in terms of other people's attitudes? Answer. Louise, what do you think? Would you like to start? Go ahead. Thank you, Kumar. I think that on the scale of the civil population, what we can do is to mobilize health staff working in healthcare, those working in our institutions. I have an example. If a pregnant woman came to the hospital and she had a disability, we have experiences of women who show up among so many others, and the nurse says, oh, given your situation, given your disability, and you got pregnant, what is the situation? You can't help yourself. It's as if the person does not have the right to live her life. And staff work in healthcare react like this, and this is not a behavior that is appropriate. I think that on the scale of civil society, there must be guidelines in this regard, how to welcome these groups, whether they're patients or in any other category. Respect for people with disabilities. This, even if the person has a disability, it does not mean that they're not a person. I will continue. There's another important aspect here, is to create the environment and the conditions so that people with disabilities can work at MSF, and to ensure, of course, that we have the reflex of creating these conditions, that our structures are accessible in order to welcome colleagues who have a disability. And something else that has come out in MSF's discussions in the regard of HR, I noticed that I'm continuing in French. I hope that this is okay. So another aspect is in case there's an accident on workplace or outside of it, people who have a disability, we have to ensure that we have HR policies that are pertinent in this regard. How can we ensure that the person can continue in the same work post so that they can continue in the same conditions? Something that I've heard is a reflex of the type of, oh, well, this person who used to be a nurse had an accident and has a disability, so cannot continue working as a nurse. This is not necessarily the case. There are many countries where people who work as nurses work with a disability. So this is a reflex we should have. It's not because somebody has a disability that they, are no longer useful to MSF. Of course, they can be a resource to MSF. And I've seen people with disabilities who've had an accident or in a wheelchair after their accident and who told me, well, looking back on these projects, as a person using a wheelchair, this gave me another perspective. We have a lot to learn in terms of retaining staff with disabilities, in terms of adapting the environment, the work conditions, etc. So it is really a reflex that we should have to try to retain these human resources who have disabilities in our project. And if we recruit people with disabilities, to ensure that we have an environment that is favorable from the point of view of staff sensitivity and the teams as well. Thank you very much, Patrice and Louise. Thank you, Kumar, for your question. We have Catherine now, who has a question. If you could switch on your video, wonderful. Go ahead, Catherine, please. Hello, everybody. Thank you very much to the speakers for your explanations. It's very interesting. I have a question for Patrice regarding the tool that you presented to assess projects and see whether projects are inclusive enough. I wish to know at what stage of the project we should be using this tool, whether we should do this when we're designing a project in terms of making things more systematic. So regardless of the project or the healthcare services that are offered, of course, it would be good for these services to be accessible. So this is my question. Great question. Here's the answer. So what we've presented is accessible. There are resources that you can all use. Please feel free to share these resources. We have no copyright on any of this material, so please do share it as largely as possible. So right now we are testing this with WACA, and it is a tool that anyone can use and within the movement. And we are happy if you have suggestions to improve this tool. This is based and follows from the motion, and from the guidelines we developed the video, the tool, and this all aligns in order to provide people with simple tools to see whether we are being inclusive enough. And this also comes from an evaluation we carried out at the beginning of our project. And we were asking ourselves about the different criteria of accessibility within missions to see whether the missions were inclusive enough of people with disabilities. And at the end of the survey, there was a question and people said, oh, if we had known that this was inclusion, we would have been doing it for a long time. So we came up with guidelines based on this, and we will send a presentation after today's meeting. So please feel free to share it, translate it, disseminate as far as possible. Please make use of this tool as much as you can. Does this answer your question, Catherine? Yes, partially. But I wonder whether these tools could be used systematically when we are developing or designing projects. Answer. Yes, well, this is the idea. We are currently testing this with WACA in order to make it a reality so that it follows on and all centers start using this. Please do not hesitate. So we have an advisory role, which means that we can recommend, but then we cannot control what happens. It is up to the people in charge in positions of responsibility to implement this, to ensure that these measures are implemented. Thank you very much, Catherine, and thank you, Patrice.
Iman, can we switch on your camera and unmute yourself so that you can raise your question or comment? It's actually a question, right?
Yeah, so hi. So we'll just have to explain that I'm a digital learning designer with OCV. So, and I've never worked in the field, just to give a little bit of background. And I suppose I kind of think of, when I think of disability, I very much think that we need to focus on disability as a positive, as in the ability within disability. And in that, what I want to kind of just the awareness around how it actually is enriching for everybody. because sometimes disability is seen as something permanent, but sometimes it can also be temporary. And I suppose I also kind of think within our field, where we have people, I have little doubt with people from different backgrounds, nursing staff and so on, may also have disabilities. So, and by actually being inclusive in this way, we actually end up incorporating more people as well. So as an instructional designer, to explain that if I design for somebody with a visual impairment, but I may also be designing for somebody with a learning disability. I may also be designing for somebody with illiteracy. I may be also designing for somebody who actually doesn't speak the language so well, but can actually understand the language well. And I suppose in the past, this idea of disability with regards to, let's say, wheelchair accessible toilets, with regards to ramps and so on, initially it might have been seen as for people with disability, but then by designing like this here, we're also designing for people who may temporarily have a physical impairment, might be designing for older people and so on. So very much this focus on ability within disability. And this is, as I said, somebody who is focusing not so much in the field, but more in the OCB office and in learning design. So my question then, my question comes to this, and the question is also within disability, I also kind of think, and again, I almost feel kind of uncomfortable using the word disability, because I really think that the A should be capital, disability. So my question is around the area of when we're designing, or let's say with digital design or web design or communication and so on, do we also include things like illiteracy? And do we also include this idea of people who are not native speakers or maybe not bilingual speakers or something?
Thank you very much, Iman. And I let Patrice or Louise take this point. Maybe that's more for Patrice, I don't know.
Yeah, I can take it. Louise, you make a big sign if you want to say, to react on that one. First of all, thanks a lot for the comment at the beginning where you said definitely that when we address the needs of persons with disabilities, we address much more broadly than that. I mean the number of people, for instance, when we talk about toilets, accessible toilets, I mean the number of women when they get pregnant or when people have a ski accident or a stupid accident and need to go with a crutches or have to use a wheelchair for a temporary period, they really appreciate and they really understand that day how important it is to have toilets that are accessible, in fact, and to have an office that is accessible. So definitely, when we design for persons with disabilities, we design, in fact, for a broader, much broader population. And that is all the concept of universal design. It's to design from the beginning for a broad population. The question about accessibility when it comes to access to different languages, if I understood well the question, so do we take in account so for us, definitely the fact to have to use easy language, for instance, to be sure that persons with learning disabilities will be able to access our information is one important aspect also of accessibility that we take in account. Different languages, I think it's very important also to consider that in MSF, and Louise probably can comment also a lot on that. But language is a huge barrier in MSF, in fact. So it's one of the barriers that we have also to take care of. And that's why we developed our portal in different languages, and there is still a lot of work to do on that in the movement. And Louise can probably talk about all the big difficulties she had also to access a lot of platforms with French language, in fact. So Louise, maybe I give you a bit of floor also on that.
Yes, I believe that when it comes to language, I should give the example of our projects. If we did not think about sign language, if we did not think about implementing Braille into our system, we wouldn't have reached as many people. Because, yes, of course, it is important to consider languages we speak, but also to adapt to the different languages that others speak, like sign language. And it's important to be sensitized to a whole array of languages, especially when it comes to people with disabilities, because today this is a problem at a global level. We must not forget a single person when it comes to inclusion, because communication and information is crucial for everyone. Thank you very much for this information and additional details, Louise. Marion, you have a question too. I'm going to let you speak now. Thank you very much, Sylvie. Can you hear me? Yes, yes, now we can hear you. Yeah, I was saying thank you so much for this amazing project, and I'm very happy to see that we are improving and we're progressing. It's amazing to see. Now, I had a short question. Now, I know that we could talk about it for hours, but as I'm working on communication for recruiting people on the field, I was wondering whether you had advice maybe to give me, or a certain tool set that I should have when it comes to inclusion in terms of trying to recruit people with disabilities on the field. Thank you very much. And I know that there's more question about the tool set in the chat, and I know that Louise is going to share her presentation, and I am sure that we will be able to add this question of tool set in the presentation. But Patrice, will you be able to answer, please? Yes, so of course we have several things to say about this for inclusivity and accessibility. One of the key elements I find is dialogue with organizations of people with disabilities. What works well is communicating with these organizations and trying to ask them, frankly, how do we reach people with disabilities? It's a recruitment that should be more proactively inclusive. That means we have to think outside the box and go beyond our limits. And this is what happens with many operational centers, that perhaps we're not inclusive enough. We wait for the handicapped person people to ask us things themselves, but it's important to be inclusive from the get-go. And it's important that we show them, those people with disabilities, that we are open to communication, to suggestions. And this is key. We must mention very clearly in our contracts that people with disabilities are very welcome to join us in the field. And now when it comes to accessibilities in structures, a good way to do this is to, again, ask around and ask what should be bettered when it comes to visiting our portals or visiting our buildings and that type of information. It's important really to communicate with people with disabilities so they can suggest us what they would like to see. And that is the secret, I would say, to being more inclusive. We have talked about this all together, but perhaps Louise wants to add a little bit to that. Yes, I would like to add the fact that the people themselves have barriers, people as individuals, because their disability is for them a barrier. And perhaps that they are worried that if they start speaking out, people are not going to listen to them because they have never found a job. But what's important is that organizations like us, like Patrice said, are more proactive in sensitizing people to these problems so that everybody can try and be recruited, everybody can be candidates. And the question is, where can we find this sort of thing? Is it something that we should put in our offices? No, because they cannot reach those offices. It should be part of an overall advertisement, not just in the building or on the floor that it is, that the office is. Because otherwise they will not be able to become candidates, because they won't know that they are able to have access to these things. Because they will not know that they are welcome unless they are told. So this is very important, especially for people who cannot see properly or who are completely blind. They must know that they can still have access to the work because, well, they think, I cannot see, so I cannot work, which is not true. And we must tell them that it isn't. We must show them that we are ready to accept them in our ranks and that we are ready to help them. These are questions that we must definitely think on and think about. We must show them that we can work with them, that we have reached certain objectives, and that we will continue to do this because we have been very proactive and all the efforts we have made have helped us improve. Thank you very much, Louise and Patrice. We hope that these answers satisfy you and that these concrete examples of barriers have helped you understand a little more and be a bit more sensitized on the question. Abdullah, you are next on the question. If you'd like to...
Time already. We'll listen to Marshall, maybe very briefly to Joanna. We'll try to close in 2 minutes. So let's try to be brief in the questions so that we can keep most of the people until the end. Go ahead, Abdullah.
Thank you to Louise. Thank you to Louise and Patrice for this wonderful presentation and to have worked on this project. I must say this is one of the successful actions we've taken so far as a result of the previous debates and then motions we've had in MSF. And so we really appreciate this action. So far, it's also recognized that there are challenges as we attempt to implement this action globally within MSF. And so because this one was one of the initiative brought up by the associations, my concern is at what level is the association claiming ownership to ensure that we take this action together, irrespective of where you are. It's going on well in DRC, like I see from Louis' presentation, but then it's entirely also interesting to know that in other missions, there are still challenges. Well, internally, you want to look at infrastructure, the environment to ensure that we have this inclusion and we do an extension to this disability and make sure that they have a place to work in the project. But then we also talk about externals, you know, at what level does the association collaborate with the externals, especially when the association is having some budget challenges and other things. So what is a limitation if you would want to collaborate with other associations on this kind of action to extend and enhance inclusivity for disability?
Thank you, Abdullah, and we'll try to answer as short as possible so that we can take Marshall as a last question before we close. Patrice, Louise?
Louise, tu veux prendre?
Louise, would you like to answer? Well, yes. I think the link that we have with those associations, well, I know that we have many associations with whom we work, and it works very well. We are in very close collaboration, and it is true. But as an association ourselves, as the MSF, we must collaborate with associations that are affiliated directly with people with disabilities, and thus we can also better our own actions by different actions that we implement little by activities that we implement with them, because it's only then that we can understand what's going on, how to collaborate and how to better ourselves, how to better the accessibility to information, for example. It's by working with people with disabilities and with their associations. For example, in DRC, they have different associations in different categories, and we can go to them and we can reach them very easily to ask all our questions and to sensitize everybody with those associations. And today, MSF takes over in certain regions, in certain aspects, because WACA is the one organization that ensures that everybody is sensitized, especially at the core of MSF. Health ministries and other organizations always try to go beyond their limits, and all that comes from willpower, from engagement, but also from the support from different parties, so that inclusivity is inclusive everywhere. Thank you very much, Louise. We will now go on to Marshall for the very last question of this event. Marshall, if you could please activate your video if possible. And I will try and answer in the chat, perhaps. I hope that perhaps maybe even after this lunch and learn, we could provide answers on all the questions that you may have. Thank you. Marshall, your turn.
Bonjour à tous, ma connexion est très instable, donc il est possible que je coupe la
Hello,
vidéo.
everybody. Yes, my connection is very, very unstable, so I'm sorry if the video ends up not working properly. But thank you very much, Patrice. Thank you very much, Louise, for showing us how the organization works and how inclusivity is lacking from time to time. So thank you so much for all your work and your presentation. I'm very happy to learn about all these initiatives. Now, I am here mostly to talk about my personal situation and the question of inclusivity of people with disabilities who work in MSF. My second and third mission, well, during them, I have completely lost my ability to control my left arm because of a workplace accident. And there were no documents made, even though I asked for them, because I was never able to give a professional medical certificate to show my disability. But years later, I kept working with the MSF in Belgium, despite being friends. Besides, I have always worked with Belgium, even though I was French. That has always been the case. But let me come back to another question. When you work at the headquarters, I'm working at the OCB in the logistics department. Now, talking about my disability while being recruited actually was a huge risk for me to perhaps being pushed aside. Let me explain myself. As a French person, it was very difficult for me to have my social rights because of my disability. And I wanted to be the head of my department in Brussels in this job. And what was asked of me is to become a Belgian resident. And it took me 2 years just to have a status of person with disabilities.
When it comes to healthcare, it's the same thing. So I wanted to tell you that sometimes I find it difficult to believe that MSF is working on inclusion because a lot of people with disabilities struggle to join MSF and sometimes feel very isolated. We have people who on medical aspects, we are helped on the medical front, but our main combat is from the admin perspective and the rights that we manage to acquire on the one hand, but that we have to lose in order to be able to join MSF. So it's a paradox and it's quite a difficult situation. I could talk about this for hours, but my question is all these intentions are wonderful, but the reality once people with disabilities are recruited is not the same. And I was asked if I would be ready to work in Lebanon with a special status there in terms of regionalization. So we have HR policies today which are not favorable to people with disabilities who require a special administrative status. So it's very difficult. Thank you very much. Thank you very much for sharing your experience, Marshall. I think that this goes back to the comment made by Dushka in the chat. Patrice, Louise, would you like to react to this as a closing point? So very quickly, Martial, let's remain in touch, please. Very happy to meet you. And let's please stay in touch and follow up on this. There's a lot of work to do at MSF, of course. And so I also would like to answer a question asked by Cecilia in terms of a network working at MSF. Yes, we do have a network. Martial, you are welcome to join us. And all of us, well, all the people here who have a disability or who are allies, please, you're very welcome to write to me in order to join the network. So welcome on board, everybody, and welcome, Martial. And I hope to be able to work together to continue lobbying, because this is also what we're trying to do to transform MSF. And I'd like to mention that Paris was working on this and took the approach of looking at issues that people with disabilities had within our offices, the issues they're confronted with, and how we can make their life easier. So I think it's a very good source of inspiration for Kevin. So thank you very much, Martial, for sharing your experience, which is very important and interesting, and which provides a good basis to continue our work. Yes, of course. And so we are now going to close today's event. I would like to thank Patrice and Louise for their presentations and for sharing their experiences and their expertise on this subject. Please do not hesitate to get in touch with them. They are available and will share all the resources that we've shared today, the presentation, the links, and they will be happy to answer your questions. We would also like to thank Ariel and Amaya, who gave their time today to interpret on a pro bono basis for this event. Thank you so much to the two of you. We hope to be able to continue collaborating with you in the future. And thank you to Modest, who joined the team, Patrice's team, within the Hub on inclusion of people with disabilities. And thank you also to Maham, who is part of OCB and played an important role in today's event. Thank you very much to everybody. This event has been recorded, so we will ensure that you can access the recordings very soon. Thank you very much to everybody. See you soon.
Merci à tous.
Au revoir tout le monde et merci à tous. Je vous laisse
Bon
débriefer.
après-midi. Bon après-midi,
Voilà.
bon week-end. Oui, bon week-end aussi, Sophie. Merci
À vous
beaucoup pour
tous
ton
aussi.
aide.
C'était vraiment très bien. Merci. Merci à tout le
Merci
monde.
Sophie.
Bye.
Salut.